kind of wanted to ask you, when someone hears functional medicine, what do you define functional medicine as?
Well, functional medicine, first of all, is definitely a patient-centered approach. So that reference I made earlier to you make the diagnosis and you kind of forget about the patient. I mean, you do have to obviously take that person into account, some of their personal habits and needs and their family and do they drive, do they not drive, whatever the things that might play into what drug is prescribed. But we really just assume that once you have the disease, that's it. And you're more or less faced with managing that disease and either prescribing a drug, referring to, say, a physical or occupational therapist or speech therapist, whatever we call that, allied health professional, or a surgeon, or maybe doing some kind of interventional procedure that's quasi-surgical, but not as interventional as open surgery, sticking a needle in and injecting something and so forth.
Right.
But basically, you're just stuck with these diseases, and that's very unsatisfactory. There's a reason when we get sick, and we all get sick. It's understandable, but we do get sick for a reason. I'm writing a proposal, and I went to the medical literature today to look something up, and there was an article that came out in the journal Nature a few years back that said 90% of cancer. 90% of cancer is not just bad luck. 90% of cancer is due to environmental factors and lifestyle.
Yeah.
I mean, that's stuff that we have control over. And if that's causal, right, then that also means that it's a mediator, it's a perpetuator. So there's sort of, think of like a seesaw, right, or something that has a fulcrum, and it's tipped in such a way that in the first part, as you're going uphill toward that fulcrum, you may not realize it, but you're getting sick, and it could be getting sick over months or even years in the case of Alzheimer's disease or Parkinson's disease. These diseases evolve over 10 to 20 years. So before you even know something is wrong, well, something is wrong, right? It's happening. And then you reach that focal point, and then things tip. And then you start to realize, wait, I'm having trouble with people's names. Can't remember, a conversation that I had yesterday. But then it continues, right? Then you would just traditionally continue along that trajectory. And this makes absolutely no sense at all. I mean, we do need these tools in our toolbox that are medicines. They're helpful. I'm not against any of that. But why should it just be that? Why can't we change the trajectory a little bit by modifying environmental factors, by modifying lifestyle for those who are willing to make changes? And thereby, even if we're not completely reversing these diseases, we're definitely altering their natural course and their trajectory. And people feel and function and think and, all of the things that we think about when we think about getting sick, a lot of that stuff goes away, or it's much less of a problem. That's functional medicine.